Good afternoon, everybody, and thanks again for joining us for another Lunch and Learn webinar. Today's topic it's an update from the NCCP on the Breast GP Referral Guideline. And with me, as always, I have Louise Murray, our support team lead. And today we're delighted to be joined by Dr. Una Kennedy, who is the GP advisor to the NCCP. I'm Donal O'Neill, I'm the head of marketing for Clanwilliam Health, and the format of today's webinar is Dr. Kennedy is going to give us a presentation overview just on the update and the background to it, and then we'll pass it over to Louise, who will actually run through the updated functionality in your system and give just a demo of how to use it in your system. So as well, just to add, we will be taking questions at the end. So if you do have any questions, you'll see a little tab on the right-hand side of your screen. If you pop your question in there, it'll come through to us and I'll put them to either Louise or Dr. Kennedy at the end as appropriate. So please feel free to ask any questions that you might have as we go through it all. And look, we'll try and get through this as quickly as possible, conscious that you're all busy. So without further ado, I'm going to pass the screens over to Dr. Kennedy, and you should get an invite now, Dr. Kennedy, to start sharing your screen.
Okay, I see it here. Right.
Perfect.
You got it?
Yeah, good to go.
Great, okay, thanks very much, Donal. And thanks very much, everyone, for attending here this afternoon. It's great to talk with colleagues. So we're going to talk about the National Breast Cancer GP Referral Guideline. It has very recently been updated, as you can see, March 2021, and it's ready to go into action on the 1st of April. So that'll be the kick-off day when people will start using the new guidelines and the new electronic referral forms in their surgeries. I should state, not everybody will transfer over on that date. It takes a few weeks for practices and for computer programs to be switched into this new mechanism. So it'll be about the 23rd of April, we think, by the time everybody's using the new electronic referral form. Now, I am not able to go forwards here. Let me just see. Oh, there we go.
There you go. Yeah.
So first, a little bit of background about the process that brought us here. Sorry, I'm not able to go back. I'm not able to go back there, Donal, I'm afraid.
If you try the up and down, or yeah, previous, there you go.
Okay, then I'll have to go back again. Okay, so this is some background. You'll all be familiar with the symptomatic breast disease clinics in Ireland. There are 8 of them across the country, and Letterkenny is a satellite for Galway. And currently about 40,000 new people are referred to those clinics by their GPs every year. So they're very popular and very successful, and I think very much liked by GPs and patients alike. The original breast referral guideline, the one we're using at the moment, was actually last updated in 2010. So it's 10, shoving on 11 years old at the moment. It is a requirement that guidelines are updated. So it's not okay to be working off guidelines, for example, that may be 20 years old. They do need to be updated. Human physiology does not change greatly very quickly, but evidence improves and knowledge and understanding improve. And it's important to review evidence and to make sure that our guidelines are in keeping with current best available evidence. The reason for this, of course, is to make sure that women with symptoms most suspicious for breast cancer continued to be triaged and treated appropriately. The updated guideline, which I hope you all have at this stage, has 3 clearly defined evidence-based algorithms, and they will facilitate you in determining which patients with breast symptoms require referral to secondary care. And the aim of all of this is to ensure that patients who have symptoms suspicious for breast cancer and require urgent secondary care are referred and get an appointment as quickly as possible. So this is the project journey. It began by establishing a guideline development group. This is a group of people to develop the guideline. And that included representation from GPs, and I was one of those GPs, representations from the symptomatic breast disease clinics, nurses, patients, and other stakeholders. And then began the process of trawling through evidence and developing guidelines. And that was done. Evidence-based algorithms have been created and developed by the Guideline Development Group, and I hope you all have a copy of them at this stage. After that, we moved on to the development of the electronic referral form that Louise is going to talk you through later. And the idea of this is that the electronic referral form has to match the guidelines and has to be consistent with the updated guideline. There has been communication with all stakeholders, GPs, practice nurses, clinics, charities and general public. We did some user testing and feedback earlier this year where some GPs tried to use the form before it went live to see how they found it. And finally, the new updated referral guideline and the form will go live on the 1st of April 2021. And as I said earlier, the updates will be complete on all practices we expect by April 2021. Just very briefly to run down through the methodology in developing the guidelines, there are standards now for the development of national guidelines. So they're not just put together any old how, there are standards that the NCCP must adhere to, and they are national standards. And it begins with governance, and the governance would be the Guideline Development Group and the Executive Committee of the NCCP. The first job is gathering the evidence. So there was a review of evidence, it was assessed and considered before recommendations were made. So the Guideline Development Group formulated recommendations that were then made into the algorithms that we will all be using. The next step would be the implementation of the guideline, and that's going to happen on the 1st of April. And finally, it's very important to evaluate the guidelines to see what impact they're having, if any. And this is what they look like. And as I say, I'm hopeful that you all either have a hard copy or an electronic copy or both of this guideline. It's very similar, you'll see immediately, to the prostate guideline, and the idea is that there will be standardization of guidelines from the NCCP from now on. As it published in March 2021 with a go-live date on the 1st of April 2021. The first page you can see on your right is just some brief advice about cancer prevention generally in women. Not to smoke, to cut down on alcohol and watch the diet and exercise. And also it's worth remembering to remind women in the right age group that they should attend for breast check appointments when they can. Moving on to the actual algorithms, this is what they look like. They're clear, they're very simple, and it should be possible for anybody, even if you're not familiar with them, to run down through them very quickly. This is the patient with a breast lump. They may present you having found a breast lump themselves, or you may find a breast lump on examination. The patient with a breast lump gets referred to the breast clinic. If you find no breast lump, well, there's two things that will happen. One is that you may find other signs, and then you will refer to the appropriate algorithm that deals with those other signs. Or you may find that the clinical exam is normal. You can reassure them, you can offer to review them at a later stage, or if there's ongoing concern, you can still refer them to the breast clinic. The next group is a more complicated group, and these are people who have a breast complaint that is not a breast lump. And in this case, the breast is sort of divided into three parts: the breast itself and the axilla, into the nipple, and into skin. And those parts are further subdivided into two groups each: people who do require referral to the symptomatic breast clinic and people who do not require referral to the symptomatic breast clinic. So to take a look at the first group, you can see obviously breast abscess requires referral, suspicious axillary lump, asymmetric focal nodularity that persists beyond one menstrual cycle. They all require referral. And here's, I think, possibly a new group to many of us, the image-detected breast abnormality found on CT or MRI. And this is a group that I think is a fairly new group to all of us. You imagine somebody who may be from, say, Australia originally, and they go back to Australia for 6 months to see their family. While they're there, they have a scan. They come back to you with their scan. And in that case, yeah, it's appropriate to refer that person to the breast clinic, but they do require that the report and the disc come with the patient to the appointment. On the other hand, I think it's self-evident, hidradenitis, axillary adiposity, I keep doing that, axillary adiposity, gynecomastia and costochondritis do not require referral to the breast clinic. And the same applies for nipple conditions and skin conditions. The last algorithm and the last group of people would be women who present with mastalgia alone. And I think the crucial word here is mastalgia alone. This is the algorithm for women who present with mastalgia as a single isolated symptom. So you take the history, perform the clinical exam. If you find suspicious findings, well then it's no longer mastalgia alone, and you refer to the appropriate algorithm for that suspicious finding. If the exam is normal, then there really is no requirement to refer this person to the symptomatic breast disease clinic. Mastalgia as a single isolated symptom on its own is not suggestive of breast cancer. So for the patient under 35 years of age with mastalgia alone, they don't require referral to the breast clinic. You can reassure them that mastalgia without any other breast signs or symptoms is not suggestive of cancer. Give them advice on mastalgia, and always, of course, safety net, advise them to return if there are other breast signs or symptoms. For the women aged 35 or older, really the same applies. However, in this age group, if pain persists after 3 months, you may consider referring them for mammography only. And it's important to note that this referral for mammography only will be on the symptomatic breast referral form, the electronic referral form, the one that we all use at the moment to refer people to the SBD clinics. In this instance, this is the form that you use to refer people for mammography only. So you don't send in a separate letter to the radiology department, for example. So the main changes that we might note, and I suspect many of us probably won't even notice these changes, it won't make a massive difference to how we work on a day-to-day. All patients who have breast lumps will be referred to the SBD clinic by their GP, irrespective of age, and I think probably we all do that anyway. For patients who are 35 years of age or older, who have breast pain persisting for greater than 3 months, there will be direct access mammography available in the SBD clinics for those women. And finally, on the referral form, where at the moment we can click urgent, non-urgent, routine, that's going to be gone. We will no longer be triaging these people. We will simply send them in, and the breast clinics can triage them into urgent or non-urgent. We've done some user testing with GPs. Some GPs very kindly gave up their time to have a look at the form before it went live and do some trial runs and see if they could break it, and they didn't manage to break it. It worked fine. It does look a bit different to the original form that we're all currently using, but we're very hopeful that there won't be any extra work involved in this. One thing you'll notice is that on the breast diagram, instead of 4 quadrants and the nipple area, we now have 12 segments. So it'll be based on the clock face, and it'll give the clinics a more accurate idea of where a lump or a bump might be found. I suppose another change is that there's a lot more detail on the form. We're giving a lot more detail now to the breast clinics, but we should be able to do that just by ticking boxes. We won't be expected to type all this free text into a text box. You should be able to click on the box and go down through it very, very quickly. As I say, the user feedback has been quite positive. The guideline document, unambiguous, concise, the referral form, excellent, appropriate pop-ups, especially when selecting breast pain as a complaint. The pop-ups that you'll see address really all the signs and symptoms that the breast clinics need to triage the patients. The form looks well, enough detail, but not too tedious, and we're really hopeful that it won't be too tedious or time-consuming. In fact, I suspect once you get quick at it, it'll probably be quicker than the current form. And finally, having this form with feasibility of access to guidelines while completing it will help optimize matters. And that's what we hope. The bottom line here is that we want women who are most likely to have breast cancer to be picked up and seen quickly. And that's me. Thank you very much, everyone.
Brilliant. Thanks very much, Dr. Kennedy. That was a really good overview and good background to the project as well. I'm going to pass the controls to Louise. Louise, they should be with you now.
Yeah, it is. Thanks, Dr. Kennedy. Right, so in here I've just got a test patient, Jane Doe, and I've filled in some basic information about her. So to do the e-referral, very same as normal, you go down to Documents, e-referrals, Add New Health Link Referral. From here, I'm just going to go Public, and I'm going to select the hospital. I'm just going to choose Beaumont as this example. And the referral, breast clinic referral. These details are going to be left as is. I'm the referring doctor, and I'm going to go create new patient if not found. So it's filling in the normal mandatory fields. This window's right, same. From here, previous hospital attendance, yes or no. In here, it's bringing in the presenting complaint and history of past illness and history of surgical procedures. You click on the plus sign beside any of these if you want to bring in some notes from the actual chart. Highlight it and say okay. Allergies, family history. Scroll down, bringing in her BMI, bringing in, you can bring in lab investigations if you want. So you highlight, click on add, and then you highlight the investigation that you want to include. It's you can also bring in clinical examination. You can just type in whatever it is you need to type in there if needed, and fill in the mandatory fields. They're all done up the top, and then we click on next. And then this is what is new and what Dr. Kennedy has highlighted in her slides. From here, we have, it's loading in from HealthLink. You got the patient's name, gender, are they pregnant? This person is not pregnant, even though it says she's got an active pregnancy, she's not actually pregnant. I have seen and examined this patient myself. Referred for, you say what it is for. 2 options. I'm going to go with the clinic appointment for this. Is the patient pregnant? We're going to say no. I'm going to say no to this. And then you have all of the other options that was included in the slide. So we want to say there is lump on the breast that we have said in the note. So I'm going to say you have to choose the right or left. If I don't fill in these details, it's not actually possible to go to the next stage. So if I was to actually decide, right, this is all the information that I need from there, symptom duration, I'm going to say how long this is for. I'm going to say 2 months. And then this is the clock the doctor was describing. So you can see here that there's actually 3 for each section. And I said on my note that it was the right. And previous attendance, no, mammogram, no. So I haven't actually filled in all the details. So you'll just see what happens if I don't fill in all the details that I need. It comes up with the message, error, please answer the breast feeding question, lump and self-detection by the patient question. So up here, this is what was up at the top. Oh, lovely.
Always happens.
To close on me. I have done this
live
numerous times this morning, and this is when it's deciding to happen, when we're recording.
You know, it never fails, never fails. And I suppose, look, we should just point out that Louise is in a sandbox environment, so it's much less stable than your live systems will be out there as well. So hopefully this won't happen to anyone else. Just Louise.
I'm just lucky. So consultation, I'm just going to go fast forward through all that I've done. Okay, I have seen and examined the patient myself. Is the patient pregnant? No, no. I'm going to say the right. So basically now I'm going to answer all the questions. Lump was self-detected by the patient, yes. The GP felt, yes. I'm going to say fixed. I'm going to say regular. And I'm going to say 1 centimeter. And I'm going to scroll down. So you can fill in the other relevant information if that's what you need. And you have to fill in the ones that have the star beside them. So 2 months, right? Attendance to the clinic, no. Previous mammogram, no. You can type in more relevant information if you need. And now I'm just going to click on the review button. Oh yes, the lump. I didn't answer this one here. Yes, review. And then this is the preview of the screen before we submit it. You can just check to see all looks correct. And we can scroll down, and then we're just going to go submit. And there it is, off and submitted. So the workflow is very similar to your previous breast referral form, but just that extra window where you have to fill in the different areas, that is new. But other than that, the workflow should be very straightforward. You should be used to it. Just the new part of the form that you'll just have to get used to. And that should be pretty much it. Is there any
Great.
questions coming in?
No, we've had no questions in. I suppose what I'm taking from that, Louise, is just I suppose the important aspects are that you kind of, it won't let you submit it until you've filled in all the details you need, and that the red asterisks are there for a reason. So I suppose that's
Exactly.
important to remember.
I think you're made host now, okay?
Sorry, apologies about that. There was a bit of feedback there. So look, I think as we've had no questions, I'm hoping that it's fairly self-explanatory for everyone. So I think we can wrap it up here. I'd like to thank Dr. Kennedy for her excellent presentation at the start, and thanks again to yourself, Louise, as well, for running through it. Running through it for everybody. Hopefully, as we said, it should be fairly self-explanatory. As always, if anyone has any questions, please feel free to get in touch with us after the webinar, and we're here to help as much as we can. And thanks very much, everybody, for joining us today. Thanks a lot. Bye bye.
Thanks, Donna. Bye.